And in health this evening, ineffective HIV testing strategies implemented by Ghana over the years has been blamed for the country's struggle to make progress towards achieving the 95-95-95 global targets. For this reason, government, in concert with its partners, are scaling up the HIV self-testing initiative to boost HIV testing services coverage with focus on men.
Out of the estimated 334,000 people living with HIV, only 65% of them know their HIV status. The Ghana AIDS Commission reports more than 100,000 people are living with the virus but do not know their status. In order to address this concern, government, with support from the Global Fund, introduced the HIV self-testing initiative last year. This year, the project is being scaled up to boost HIV testing services coverage by improving case findings and locating hard-to-reach populations, especially the men who may otherwise not be reached by traditional approaches to HIV testing services. Ahead of the project implementation, a 3-day training workshop has been held for some 50 civil society organizations who will champion the cause in 50 HIV high-burden districts across the country.
The NGOs are expected to go into the various communities and distribute the HIV self-test kits. So what happens is that if they come across anyone in the community, they will first counsel them and give the test kits to them. For those who will test reactive, we encourage them to go to a nearby health facility for a confirmatory test. So once we are going to the community, we are mostly targeting men for this particular implementation.
Programs Manager of the National AIDS STI Control Program, Dr. Stephen Eyisi Ado, is confident with all stakeholders on board, a major impact can be achieved in the country's response initiatives.
If we are able to reach out to them, there will be impact and we will reduce these new infections. We need to do one and less, and therefore it requires more effort, it requires civil society participation. We cannot continue to distribute or provide access in only facilities. We must engage the community.